Hello, it is Ryan, and I was on a flight the other day playing one of my favorite social spin slot games on ChumbaCasino.com. I looked over at the person sitting next to me, and you know what they were doing? They were also playing Chumba Casino. Coincidence? I think not. Everybody's loving having fun with it. Chumba Casino is home to hundreds of casino-style games that you can play for free anytime, anywhere, even at 30,000 feet. So sign up now at ChumbaCasino.com to claim your free welcome bonus. That's ChumbaCasino.com and live the Chumba life.
No purchase necessary. VGW. Void where prohibited by law. See terms and conditions. 18+.
Hey all, welcome back to the Real Life Pharmacology Podcast. It is a very special day, last week or two that I've had. The Flippin' Pharmacology flashcards are available, at least in the United States, on Amazon. So, great way to support this podcast and get a great product as well. I had somebody help with the design. She did a fantastic job on those flashcards. They are very durable, great color, great resource for anyone taking pharmacology classes or board exams. It's going to be really, really helpful, I think, for you to help organize your thoughts and prepare for any exams you may be taking. So go check that out on Amazon, Flippin' Pharmacology flashcards. All right, with that, let's get into the drug of the day today, and that is pyridostigmine. Brand name of this medication is Mestinon, and this was a request by somebody. So just trying to do as many of those requests as I can. I get quite a few emails, but this one kind of sent off an alarm a little bit in my head because it's a pretty rare medication. It's not used terribly often in practice, but there's a lot of great teaching pearls here. So with that said, pyridostigmine, mechanism of action of this medication, it is an acetylcholinesterase inhibitor. If you remember back to some of the dementia medications like donepezil, that has a similar mechanism of action. So if you can do that in your preparations for studying or just, out in your day-to-day practice, if you can lump medications together that have similar mechanisms of action, you're probably going to be able to understand what the adverse effects are. If you understand the side effects of one, you're going to understand the side effects for generally all medications in that class. Now, obviously, there are exceptions and things like that. But being an acetylcholinesterase inhibitor, this medication ultimately blocks acetylcholine breakdown, so there's more of it around. And one of the primary uses that I've seen this medication used for is myasthenia gravis. So if you remember, that's kind of a muscle disorder where there's weakness and fatigue. And pyridostigmine can help with some of the transmission of impulses in neuromuscular junctions. So basically helping those muscles work a little bit better and obviously improve upon that strength that's an issue in that disease state. So that is the number one use that I've seen pyridostigmine used for in practice, at least in my practice. Dosing, it is dosed typically 3 times a day. 30 to 60 milligrams is the most common dose I've seen utilized. I've seen upwards of 600 milligrams or so. As you push that dose, you generally tend to run into adverse effects. In the literature, I did see that I believe some people have used up to 900 milligrams or so. Not something I've ever seen in practice, but I could imagine that the risk for adverse effect goes up significantly as we raise that dose there. The other use that I have seen it used for, not very often, is orthostasis. So typically with orthostatic hypotension, that drop in blood pressure, most common medications we used are probably fludrocortisone or midodrine. Those are probably the two most common that I've seen used. Pyridostigmine is kind of a second line type of agent in most situations, but it certainly can be utilized and has been utilized in that situation. Now, let's talk about adverse effects a little bit. So, this medication, generally, it's going to be recommended to give with food, particularly if there's GI intolerances, GI cramps, diarrhea, nausea, those are going to be the most prominent symptoms. And if you remember back to the donepezil podcast, diarrhea is definitely a common thing that I see in dementia patients as we escalate that dose of that medication as well. So again, that similar mechanism of action, you're likely to see similar adverse effects. And in some patients with pyridostigmine, if the medication is really beneficial for them, there are cases where we may actually give an anticholinergic with this medication. So there you're giving a medication that's basically blocking some of the GI adverse effects and could potentially cause the opposite to happen. So remember, anticholinergics, they are going to cause constipation versus diarrhea. So we're giving two medications that kind of counteract each other in rare cases there, which definitely as somebody that does not like polypharmacy, that's generally not something that I would ever approve of if possible. But there may be rare cases where we've got to blunt some of those GI side effects, and hopefully we can still get some of, in the case of like myasthenia gravis, hopefully we can still get some of the muscle strengthening effects from it and block some of the adverse effects from that medication. So GI, that is going to be the most prominent thing to look out for with adverse effects: cramping, stomach upset, diarrhea. Other adverse effects, and if you can think about anticholinergics, which are really, really common, and think about the opposite of that. So increased salivation can happen. So remember, anticholinergics can cause dry mouth. So you would naturally think pyridostigmine acting in the opposite direction or the opposite way, increasing acetylcholine, we're going to have the opposite effect. We're going to increase salivation. Other things that can happen, I believe I talked a little bit about bradycardia with donepezil previously. So that can certainly happen. Sweating is also reported as a potential adverse effect of pyridostigmine. So again, I really want to emphasize that educational point of understanding the difference between an anticholinergic drug, which is going to basically block acetylcholine's effects, versus a drug like pyridostigmine, which is basically going to increase acetylcholine's effects. Okay, so just knowing kind of the yin and the yang of what happens when we get too much or too little acetylcholine, that can really help you understand pharmacology and be able to remember these things as you're taking an exam or you're out in clinical practice trying to identify side effects in patient cases and things of that nature. I mentioned anticholinergics in rare cases may be used with pyridostigmine. Glycopyrrolate and hyoscyamin are two of the agents that I have seen used with this medication. Again, doesn't happen terribly often. We don't like to do it if we don't have to, but it is something you may see out there in practice. Now, I want to talk about one other quick indication with pyridostigmine. So it actually has an indication for reversal of non-depolarizing neuromuscular blocking agents. So I think the important thing to remember in this is if you've got a patient with myasthenia gravis, they're taking pyridostigmine or another indication, you've got to recognize that pyridostigmine could blunt the effects of some of those neuromuscular blocking agents. So that is definitely, if you're a nurse and primary care provider, pharmacist, whatever, if you need to make sure that surgeon's aware, if we're going to use neuromuscular blocking agents, that pyridostigmine could block or impact the way that drug is going to work. So really, really important to think about that in patients using pyridostigmine who are undergoing surgery. And obviously we want to know what type of surgery it is and what medications are going to be used. But I think that's a really, really important piece of information to be sure to relay to surgery and anesthesiologists and things like that. So definitely pay attention to that if you know a patient's undergoing surgery and on this medication. Monitoring parameters, probably pretty simple, pretty straightforward. Pulse, I talked about that a little bit already. Blood pressure, And then as clinically indicated, we may look at EKG there as well. All right, let's take a quick break and we'll wrap up with drug interactions. Head on over to reallifepharmacology.com. Go ahead and subscribe there. I've got a free 31-page PDF on the top 200 drugs. It's a great resource pulled from my clinical practice as well as my experience in taking board exams, pharmacology board exams, pharmacy board exams. So that top 200 list has a lot of great clinical pearls that you are going to see show up in real life and in board exams as well. So simply an email will get you access to that. And again, you can sign up and get that at reallifepharmacology.com. All right, let's wrap up with drug interactions. So anticholinergics are probably the first place I'm going to start. If you've got somebody taking pyridostigmine and they're taking, let's say, over-the-counter Benadryl for sleep, that anticholinergic activity is going to directly oppose the potential beneficial effects of pyridostigmine, or what we're using it for. So very, very important to recognize that and look at what your patient's medications list is, and then obviously identify any anticholinergics and make sure they're being used appropriately there. Beta blockers can have additive effects on the low pulse adverse effect, so that's something to keep tabs on for sure. Obviously, drugs that have cholinergic agonist type activity, I alluded to the acetylcholinesterase inhibitors that are used for dementia. Using this in combination with pyridostigmine can really amp up potentially some of those GI adverse effects like the spasms and cramping and diarrhea, for example, there. So definitely pay attention to that. The NMBAs, I went over a little bit, the risk of that, pyridostigmine potentially opposing the way they work. So definitely pay attention to that. And then the adverse effect profile, diarrhea, nausea. I think of medications like metformin, colchicine can definitely add on to the adverse effect of diarrhea. Nausea, I think of GLP-1 agonists, for example, used in diabetes. They can definitely cause some significant nausea. So again, kind of more of an additive effect, additive type drug interaction in those situations. All right, well, I think that's going to wrap up the podcast for today. Go check out Amazon, Flippin' Pharmacology flashcards. Great resource, beautifully designed, and I think you're going to find them really, really helpful. Great gift as well if you're precepting students or you know somebody going through pharmacology classes in college. Again, Flippin' Pharmacology flashcards on Amazon. If you want to track me down, got suggestions for the podcast, you can do that, mededucation101@gmail.com. Track me down on LinkedIn and connect with me there as well. Eric Christensen, PharmD, BCPS, BCGP. As always, leave a rating review if you're listening. If you enjoyed it, found this episode helpful, I greatly appreciate that. Helps us grow the podcast, reach more people, and all that good stuff. So if you found this podcast helpful today, I hope you'll take the time to do that. I certainly appreciate it. With that said, I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.
Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18+. Terms and conditions apply. See website for details.